Thank you very much for joining us today for this media briefing around the theme of Protect West Norfolk. We're going to be showing some important messages around protecting West Norfolk over the next few weeks and some updates on what the Council is up to. So I'm really pleased to welcome today, we have James Wild, the MP for North West Norfolk, Councillor Brian Long, Leader of the Borough Council of Kingsland and West Norfolk. We have Councillor Stuart Dark, Cabinet Member for Environmental Services and Public Protection, Lorraine Gore, Chief Executive of the Borough Council of Kingsland and West Norfolk, Dr. Louise Smith, Director of Public Health. I'm here to chair. We also have Sharon Clifton and Kate Gooding in the meeting today from the Borough Council and County Council communications teams as well. So again, if there's questions that we don't address in the session, you can ask them to the comm teams afterwards. Just a reminder of how we're going to work today. Please have your microphones on mute unless speaking. You've got a lot of details within your media statement, and we can make the visuals available afterwards. When we get to the questions, if you could direct them via the messaging facility, that allows us to kind of direct them in the right place. Again, as I mentioned, Kate and Sharon are here today, and any other questions can be directed to the Council comms teams. And we're recording this, and it will be shared on the YouTube channel afterwards. So I'd now like to invite James Wild.
I'm going to be put on YouTube later.
I'd now like to invite James Wild, MP for North West Norfolk, to give us some opening remarks, please.
Thanks very much, Michelle. A week ago today, I and many other MPs voted to introduce national COVID restrictions. I wanted to avoid having to do that because I know how challenging these rules are for people's well-being, for businesses, for jobs. And I don't underestimate at all the toll and disruption that the pandemic has had and continues to have on our community in West Norfolk. But I reluctantly supported those measures on the basis of the data on infections that showed that the risk to local NHS services, including at QEH, would not be able to cope. And since then, the reported infection rate in Kingsland and West Norfolk has increased. So now's the time for everyone to redouble their efforts, to follow the rules in order to protect themselves and their families and friends. We came into these national restrictions as a county at a lower tier than many other places, and that was thanks to the incredible efforts that everyone had gone to. And when the controls end on the 2nd of December, I want us to exit back to a lower tier with fewer restrictions on our freedom, on our daily lives, and on our businesses. So the message today is let's all play our part in protecting West Norfolk.
Thank you, James. I'd now like to invite Councillor Brian Long to speak next.
Yes, thank you, James, and thank you, Michelle. The first thing I want to do is thank the people of West Norfolk, not just the key workers, the council workers, those in the NHS, etc., who've done so much over the past few months, but actually the public at large. We've all got to play our part in making a difference to beat this virus, and we can only do that with the buy-in from the public. And I appreciate that the lockdown phases have been difficult, and some people, really do struggle with them. But it's really important that we heed the messages we're given and do our bit to help West Norfolk. I'd also like to thank the local media, because they've been really good at getting that message out to the people in West Norfolk, and they need to continue to do that for us if they really can, because it's so important that people are reminded of these messages. The last thing we want to have is a spell of lockdown that we're in now and come out of it in a worse position than we went in. And as James made reference to, as we went into this lockdown, numbers in West Norfolk were starting to increase at quite a pace. I think it's really important on all of us to do our bit to mean that we come out of the lockdown in a better position with a better control over the virus than we've had of late. We've got to protect ourselves, protect each other, and importantly, protect West Norfolk. we've had a message from Caroline Shaw at the Queen Elizabeth Hospital, and I think if we can move on to the next slide. Yeah, the Trust is, as it says, is doing everything it can to safely care for our patients this winter, but we really need our community to help us by playing their part. They can't do it alone. The council can't do it alone. We absolutely need buy-in from everybody, and to get some details of how we're going to progress this and to what we need to all do. I'm next like to pass you on to Councillor Stuart Dark, who is the Borough Council's responsible portfolio holder for public protection. Stuart.
Yeah, good day everyone, and can I reiterate Brian's comments of I'm really pleased that you've attended today because you've got a role to play in this around getting these messages out to our communities. As you've seen on the slides, we've all done this before. During the first lockdown, everyone came together, everyone played their part, and we supported our NHS. Unfortunately, the data around the lockdown is we do need to do this again. We've all got our part to play. What we do today, individually, will make a difference on how the figures are tomorrow. What we do this week will be how the figures are next week. And more importantly, as we emerge out of lockdown in 3 weeks' time, what's here and how much we can open up to support not only the freedoms, the movements that we'd like to do, but also the interactions and most importantly, our businesses that are really suffering at the moment. So this isn't about cases coming in. Whilst the national lockdown is welcome and we can see high figures elsewhere, we have coronavirus still in our community. It's transmitted within our communities as the data suggests. And thankfully we did start from a low base rate, but those numbers are increasing and we need to make certain that we do all we can individually to bring it down. So we've all got to act together to stop the spread. Next slide, please. One of the messages that we do need to get to people around this is it's vital that people self-isolate. So we do have all of the measures in place around restricting movement, etc. But actually, if you have the symptoms, it's important that you self-isolate as soon as you possibly can. Whether it's a positive test result or you live with someone who has coronavirus and a positive test, self-isolating means you must stay at home, including within the lockdown. So it's no having the test result and thinking you need to get out one last time to do a shop, etc., etc. We can support around that. It is important that if you have it, that you actually lock down. Next slide, please. We're doing a lot of work at the moment as a council, and the county are doing a lot of work around young people and schools, and our schools are knocking it out of the park around the work they're doing to protect the children in the schools and our educational establishments. But we need to bear in mind that young people in West Norfolk have made many sacrifices around their education, around their interactions with their friends, exams, etc. already. And I'd like to thank all the young people who are helping to stop the spread by actually abiding with the guidance and working within these changed settings. Now we're working with the schools to reduce the threat, the spread, and we are actually doing an awful lot within the schools. However, there is something to be said around what happens at the school gate. So for example, parents dropping children off, having a chat with friends outside the school gate, groups of children meeting up on the way to school, and that interaction needs to take place within the guidance. It's important that we actually support the schools doing the work they're doing within the school gates and within the immediate environment of the school to make the environment as safe as it possibly can. And it's important that we do that going forwards. Next slide, please.
So I think it's over.
This one's for Lorraine now, I think.
Yeah, thank you, Councillor Dark. I'd just like to add my thanks, along with Councillor Long and Councillor Dark, to everybody who's joined today. As I live in West Norfolk, as many of us do, and feel passionate that we need to support each other. We have family and friends who live in West Norfolk, and it is part of our role, not just here as councillors and officers of the council, but as individuals as well. So again, thank you all. So as a council, we will help West Norfolk. We need to get through this crisis. We are going to do some proactive work and use these weeks of lockdown to do that work, to get out and engage and try and get the messages out, hence why we're having this conversation with you today. And we very much appreciate your help and support in helping us get these messages out and continue to get these messages out. We'll continue to operate as many of our day-to-day services as we can. As we did during lockdown in the first wave, our refuse contractors will be out collecting the waste. We'll be operating our democratic process. So many more services are operating this time than we were able to operate in the first wave. But the key message is that we've all got to act together to make the difference for West Norfolk. Next slide, please. So some of the areas that the council is supporting West Norfolk on, business grants, as part of the lockdown measures, the government announced local restriction support grant, and our website will be updated this afternoon with information on the grants which will be made available. And we are hoping to be in a position to start receiving applications on those next week. In addition, there's additional restrictions grant. This is a discretionary fund that is still being developed, and this funding will cover not just this lockdown period, but over a longer period of time. And we'll be working up proposals for that, and our website again will be updated for that information. Support for the clinically extremely vulnerable. Our Lily is there, as it was in the first wave, to support vulnerable residents. Norfolk County Council have circulated a letter to everybody who's in that group, and there is a contact number hotline for people to contact. We can provide that in the chat if you want that information, and those people contacting the contact line will be triaged across to West Norfolk so that we can provide that support locally. And that includes support not just in the lockdown, but also for those people who are asked to self-isolate. So if there is difficulty getting food and medicines, please do not leave your home. If you are told to self-isolate, please contact us and we will help you with that. We are also looking to provide additional emergency accommodation for vulnerable groups, the homeless in particular in our area. So there will be additional accommodation going in. This will be in addition to the night shelter that this year has to operate in a vastly different way because of the COVID restrictions. And our Live West Norfolk team, unfortunately, again, have been asked to close as part of the lockdown, but they will be providing some virtual activities. So if you still want to keep fit, Alive West Norfolk is there to help you. Next slide, please. So I'll hand over now to Dr. Louise Smith, the Director of Public Health.
Thank you, Lorraine, and good afternoon, everybody. It falls to me to share the data and the current situation in West Norfolk. Overall, our incidence in the past week per 100,000 population across Norfolk has been 95. So our overall Norfolk rate is 95 per 100,000, and that compares to last week when it was 100. So you'll see that the overall rate in Norfolk has stayed pretty stable in the last 7 days. But the reason why we're holding this press conference today is to look particularly at what's happening in Kingsland and West Norfolk. And we are seeing in this local area a very different pattern. So the case rate per 100,000 in the past week to the 9th of November for Kingsland and West Norfolk was 145. That compares to 88 in the previous week. So over this past week, we've seen a steep rise in the number of cases being seen in the West. That's not entirely unexpected, and is part of the projections and the data that we were anticipating, which formed the discussions and the debate about the necessity for a lockdown. But it is a really important message for Kingsland and West Norfolk. With a rate of 145, this makes it the second highest district in the county. Rates have continued to climb over the past week. We can link about half of recent cases in the area to a small number of known outbreaks. And again, this is different to the pattern that we've seen in a number of places before. It means that at least half of the cases are community-based with no clear explanation. And that means it's likely that the virus is being spread in the community, adding emphasis to the importance of everybody working with the lockdown, getting tested when you need to, and self-isolating if you are asked to. In terms of looking at where the infections are in Kingsland and West Norfolk, one of the areas we're aware of is that there have been outbreaks linked to local schools, and that's what's informing some of the additional work working with schools. We are seeing more admissions to the Queen Elizabeth Hospital, and there are now 32 people inpatients, 32 in the general wards and 1 in intensive care. With the advances in health treatments, fewer cases are being admitted to intensive care, but we are seeing the numbers rise in the general wards. And the people of West Norfolk have pulled together throughout this pandemic, and it's only by working together that we will bring the rates down again. We've every reason to think that with the lockdown, if we follow the rules, we can get these numbers back down again. So please follow the restrictions, stay at home as much as possible. Wash your hands, make space, wear a face covering where needed. And if you develop symptoms, please ask for a test. We've done this before successfully, and we've brought the rates of the virus down, and together we can do it again. I'll pass back to you, Jeff.
Thank you. Lorraine, can I hand over to you? This slide, please.
Yes, thank you, Louise. So the key messages are on this slide, and we need your help for us to be able to share these as wide as possible. As Michelle mentioned, we have got some graphics that we will share with you. We are going to work with schools to get some graphics up, hopefully around the exterior to schools, to reinforce that message about it's not just the activities inside the school that influence the transmission. There are also those activities when you're outside the school gate and when you go home, and how you travel home and what you do when you get outside school. So the key messages as they are on there: stay at home as much as you can. Don't meet people indoors. Only meet one person outside. Only make essential journeys. And remember the hands, face, space. And particularly, we want to emphasize about self-isolation. If you are asked to isolate, if you are contacted by test and trace, then please do self-isolate. If you do have problems with food or medicines, then please do contact us. We are here to help with that. We are going to do some additional comms messaging with young people because we want to thank them for the efforts they have done already, but we think they are able to pass that message on and be some ambassadors for us as well. So we will be working along that. Thank you very much, and I'll pass back to Councillor Dark.
Yeah, thank you. The key bit for us around this is that, as we said, hopefully as a golden thread through everyone talking at this presentation, is that we are all in this together. The QEH, who have absolutely deserved all the plaudits that they've got, are working hard again on our behalf. And the infection rates within our community, it's down to us as to whether they go up or whether they actually start to stabilise and go back down, which allows us to come out in a better place than where we are. So the key message must be for all of us, individual acts will build and help us with this. So protect ourselves, protect each other, and protect West Norfolk.
Thank you, Councillor Dark. If I could just invite closing remarks from James Wild, please.
Yeah, thanks. I think we've got a very strong community spirit in West Norfolk. It's one of the things that sets us apart from other parts of the country, and now is really the time when we need to channel that and come together. We've been through really difficult times in the first wave of this pandemic with high infection rates and very sad loss of life. We've heard about the increased case rate from Louise just now, and we've got the opportunity, by following the advice, by self-isolating when we're asked to, by not meeting people indoors, following all the rules, we can help control this virus. And the important point is there's support there. If you have to self-isolate, there's support to help vulnerable people, to get you supplies if you need it, to protect jobs and income. So let's come together, let's work together, protect ourselves, protect each other, and protect West Norfolk.
Thank you very much, James. So if I could just thank James Wild, Councillor Long, Councillor Dark, Lorraine Gore and Dr. Louise Smith. We're now going to take some questions. If you could pop your questions onto the chat, and then what we can do is we can direct them to whoever's best to answer those, please. So if anybody has any questions, if you could pop them onto chat for us, please, that'd be great. Okay, so I've got a question here from Chris Bishop, and this is for you, Dr. Smith. Is there any explanation for increased case numbers in Wardens, South Norfolk and Great Yarmouth?
So I think the explanation is that like many other parts of the country, the transmission of the virus has gone into what we call epidemic phase. This was some of the early evidence that we were seeing that very much supported the need to go into lockdown, that we had started to see more of this transmission in the community, and we're anticipating seeing numbers going up in areas that had been low before. But I would emphasise that overall total numbers across Norfolk have not significantly gone up over the past week.
Thank you. So I've got a question here from Ben Hardy. What has been the response from the COVID wardens dealing with the public on the streets of Kingsland so far? I wonder if you'd like to answer that.
Do you want me to take that?
Yes, please.
So we have some marshals in our urban areas, and we will be increasing that presence of people on the ground, walking and engaging. So our role is very much about engaging and educating, because we know a lot of our businesses are really doing the right thing, but if we do identify any areas where that isn't quite happening as it should, we will be escalating those up, and our environmental health colleagues, etc., will be going out and engaging. I think, you know, the response, people are grateful for any support. If we do identify areas, we will escalate those through the right channels, but I think overall people are reassured by the presence and that extra education and engagement.
Thank you, Lorraine. So another question here from Beth Ridding for Dr. Smith. You mentioned about there being a lot of cases from some small outbreaks in West Norfolk. Can I ask what these are, please?
Okay, so the point that I was making was that unlike some of the other areas in Norfolk, we do not have in West Norfolk at the moment a large outbreak. we have lots of small outbreaks and clusters, most of which are very small numbers of cases. So we're in a different situation to where we were perhaps a month or two ago when we were dealing with perhaps several hundred cases in a single outbreak. It's just not what we've got here. We've got clusters of small numbers, often under 10 and under 5, linked to businesses and workplaces. And that's a particular challenge for us because it means that responding to the virus needs to be distributed and spread out across the community, that we have community spread. It's not a case of it being focused or concentrated in one business or one setting.
Thank you, Dr. Smith. Councillor Dark, this is a question for you from Chris Bishop. Will the council be offering to make leisure venues available as vaccination centres when it's rolled out?
Yeah, thank you for your question, Chris. I think there's a couple of things there. First of all, that will be, any vaccination rollout will be led by our colleagues at Public Health and the NHS. And obviously, as a borough, we'll be doing everything that we can to support them. And whatever venues they ask for, if we have them, we will be making them available. However, I do think the key thing is around this is that the current talk around vaccinations and potential for them coming in weeks or months or however soon that might be, shouldn't detract us from the here and now. And the here and now is, we've heard from Louise that the infection rates have been rising in our community. And it's around not just hoping for a vaccine, it's doing individual collective effort to make that when the vaccine does come, if it does come, that we're in as good a position as we can with as low transmission rates as we possibly can. Because one's talking about something that may be coming down the track, the other one is actually, where are we now and what can we actually do to make the situation better for ourselves, our neighbours, West Norfolk and the NHS.
Thank you, Councillor Dark. Does anybody have any further questions they'd like to ask of our speakers? Okay, so if there are any other questions you'd like to ask, please do direct them to Sharon and Tim in the Borough Council Comms team, or to Kate in the County Comms team. Also, yes, one more from Chris. Is that you? Is there a particular type of workplace, business like pubs?
So I'm going to guess that may be a question that it's suitable for me to pick up. We always see, when we look at the cases, a slightly higher number of cases in the places where we're testing. So there's clearly a number of cases that we're identifying from the care home screening, and people who are diagnosed as positive when they're, for example, being admitted to hospital for other reasons. Those are significant contributors to the total number of cases that we've seen over the last couple of weeks in Kingsland and West Norfolk. The next group where we see a significant number is in school-aged children. Again, it's easier to map cases to school because that's where all young people are. So we need to be careful not to overinterpret that statistic. But we have seen outbreaks in local schools. And that's why one of the really important pieces of work that we're doing with the community in West Norfolk is focusing on high schools and those messages related to social distancing, including outside of schools, at the school gate and in the streets around the area. But when we come to think about outbreaks and look for those specific places in West Norfolk, I would emphasise again that we don't have the data like we've had in other places to pin this on one or two specific areas. The vast majority, at least half of our cases, are unknown in terms of being linked to a specific area. So to sum up, we can focus on the areas where we most detect coronavirus: healthcare settings, hospitals, care homes, and following hot on the heels of that in schools. But at least half of our cases are community spread, which means that this really makes it everybody's business, not just to protect yourself and your family, but to protect the community of West Norfolk.
And additional from Chris, can you explain why cases are suppressed in Hunstanton and parts of the Fens? Is it simply because we are talking about a lot of small outbreaks? Also, why so high in South Lynn and Springwood? Dr. Smith, would you be able to answer that?
The spread of the virus is not even. It clusters in networks and groups. The most likely reason for you to be infected with coronavirus is because there's already somebody within your household or social group who has the infection. So we always expected that we would see quite a lot of variation between different places. So high numbers in some places, low numbers in others, just due to the random chance and the uneven way in which the virus spreads from person to person.
So does anybody have any more questions that they'd like to ask of our speakers? Thanks, Beth. Just leave it for a moment to see if there are any more questions. Okay, thanks, Ben. Thanks, Chris. Okay, so just before we close, if any of the speakers like to add anything else to the comments they've made already? Okay, well, thank you again, everybody, for joining us today. Really appreciate the time, and this will be made available on the YouTube channel. And as I said, if you have any further queries, please direct them to the Borough Council and County Comms teams. And thanks for joining us today.
Thank you, Michelle.
Thank you, everyone.
Thank you.
Thanks, everyone.
Everyone, thank you.